This podcast is recorded on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people.
British Columbia, I've seen your mountains high, seen your pretty rainbows and your blue crystal skies, watched your winding rivers as they flow around the bend. To me you're not a stranger, you'll always be a friend.
Coming to you from the West Coast, this is Politicos. Today is March 12th, 2020, and this is episode 180.
I'm Scott Lundebaum.
And I'm Ian Bushfield. On today's show, we're doing a socially isolated pandemic special as we record from each other's homes.
Yeah, so out of an abundance of caution, we've decided to go remote because I've got a bit of a cough, but should hopefully come through just fine. And well, that's pretty much all we'll be talking about this week is the news that seems to be on everyone's mind, the COVID-19 pandemic.
Yeah, it's all anyone's talking about. But let's thank those who help make the show continue to be possible. We're up to 90 contributors each month. We gained a number of new patrons this past week. Thank you, Vexel, Robbie, and Jared. We're at $267. We can always use more. We're still examining options for editors as we move on. Unfortunately, Cortado is moving on to different and better things, I'm sure. But that leaves us looking around for new options. So if you are someone who's keen to edit podcasts, drop us a line or at least throw us a couple bucks. Also, Politicos is in partnership with BC Today, British Columbia's daily newsletter dedicated exclusively to BC politics. Sign up for a free trial to have unique coverage of the BC legislature delivered to your inbox every morning. Listeners to Politicos, enter the offer code CITIZEN for access to a special rate. For your free 2-week trial of the newsletter, go to politicstoday.news/free-trial. So let's jump into this conversation about the pandemic. It's an official pandemic according to the World Health Organization. And because I think it's worth the public service announcement, even if people have already read a ton of stuff, to just go through what the Public Health Agency of Canada is saying, what the BC Ministry of Health is saying, what our Chief Public Health Officer is saying, and just try to relay that information as best as we can. And then also throw a whole bunch of links in the show notes, caveating that everything is transpiring really quickly. So we're recording it just before 8 p.m. on Thursday, March 12th, and things could be changing very fast.
Right. And of course, don't take medical advice from podcasts. We're just relaying what's on the various public health websites and all the excellent reporting on this. But please go to the BC CDC website or your relevant local one to find out directly rather than just relying on what we're going to say here.
So here in British Columbia, we have 53 confirmed cases of the novel coronavirus. 7 of those are new today. 1 person is currently in hospital. So far, 6 have fully recovered and 1 has unfortunately died. A lot of the cases seem very well explained, which gives me a lot of assurance about how our provincial health system has responded. They're either people who have traveled from infected regions or largely connected to those cases. There have been 2 care homes now, long-term care homes, where outbreaks, might be too strong a word, have happened, where a number of cases have been reported. And I think the connection between those 2 care homes is care workers who had to go from one shift to the other and unfortunately brought it into the other facility.
Yeah. So I believe there's been a couple cases that they haven't quite identified the source of that aren't obviously tied to one of the retirement homes or trip abroad. But other than that, there hasn't been a lot of signs of community transmission, and those couple cases are still being investigated and may find out. Hopefully the public health people will find out where they came from pretty quick.
Yeah, and Public Health Agency of Canada at least I pulled this number yesterday at all the cases across the country. 79% were travelers and another 12% were close contacts of travelers. So we're not at an outbreak situation in Canada yet. And that's what Dr. Henry said today. I don't believe we had widespread community transmission, but a number of the measures being implemented and presented are to prevent it from happening. That, it's possible that someone is carrying it without knowing, thinking they're just lightly sick. And if we're all just taking extra steps and being extra cautious, we can stop it from becoming the situation that's currently happening in Italy or happened in China.
Yeah.
So, risk factor is low across Canada, but of course, if you have you're in one of the higher risk categories, for example, you're over 65, you have compromised immune system or underlying medical conditions, those are the people we're trying to protect. So, recommendations: if you have mild symptoms, stay home, call your local public health authority, inform them. In BC, you can call 811. I know people have been filling those phone lines up, but just call if it's busy, hang up, have a bowl of soup, call again a bit later, and they'll help you figure out if you're, you know, need further testing or just need to take some time off. The main symptoms of COVID-19 that you're looking out for are fevers, coughs, difficulty breathing, possibly pneumonia, although I don't know what pneumonia feels like.
I gather it's hard to miss when you get pneumonia. It's when your lungs are starting to fill with fluid and have difficulty breathing.
It's unpleasant, I imagine.
It's unpleasant, and from what I understand, only common in the most serious cases. But I think the most serious 20% or so is seen pneumonia, and those are the ones that typically require hospitalization.
Right. Yeah, you're looking for that fever and higher temperature. But otherwise, the standard advice is still out there. Wash your hands with soap for 20 seconds. If you can't find soap, get alcohol-based hand sanitizer. Don't cough into your hand or on other people. Obviously, cough into your elbow or ideally a disposable tissue. Stop touching your face. It's gross. Don't touch other people's faces, obviously.
A lot of places have also started to avoid handshaking, and you've seen various things like fist bumps trying to replace it. But yeah, just in general, try and keep your hands as clean as possible and avoid touching your face.
And disinfect everything you own. You've probably never washed or cleaned your phone. Obviously, don't just dump it in the water, but if you can get a Lysol wipe, or if you can, figure out how to clean your phone safely and everything else you touch frequently, that can help just reduce the spread. And these are all good tips in general cold and flu season. Let's just stop getting each other sick so much.
Mm-hmm. Of course, in general cold and flu season, there's people with built up immunities, have the flu vaccine, and that just isn't something we really have at this moment, which is part of the reason why COVID-19 has been such a major concern and spreading so quickly, is because of that lack of immunity and the real concerns that because nobody has it, it's going to ultimately end up overwhelming the healthcare system.
All right, so there's a number of new measures being introduced even just today, this afternoon here in BC. Let's break down what Dr. Henry's recommendations and requirements are.
Yeah, so every day this week, Dr. Henry, the provincial health officer, has been doing a press conference going over the latest numbers and new advice. But today in particular, the steps the government's taking took a fairly dramatic turn, as they are now advising against all non-essential travel outside of anywhere outside of Canada, including the US, and that returning travelers from abroad are going to be required to be in isolation for 14 days.
That's quite a big one. I mean, we saw just yesterday the US announce, or Trump announced, this travel ban to Europe, and then today seemed like the day where everything was breaking, like the Major League Soccer, Major League Baseball, the National Hockey League, all postponed all of their games, which is a lot of events.
Yeah, it really seemed to start to take a dramatic upswing yesterday, and today was only busier in the news. Yesterday, the NBA ended up canceling the rest of their season. I believe Washington State and Oregon as well put in limitations on groups of larger than 250 people, which BC followed today.
Yep, all big events have to now be canceled, and this includes religious gatherings. I guess the premier, the health minister, and Dr. Bonnie Henry were speaking with religious leaders yesterday, and while the contents of that call weren't reported, it seems to me like after today's announcement that they were advising them that, all right, your mega church rallies need to be broken up. And we've seen moves from like Catholic Church and higher officials saying, well, all those things that we say are mandatory, we're going to make them not mandatory for a while, because it would be good if all our parishioners didn't get sick from sharing holy water.
Yeah, that's. I think the Catholic Church ended up taking the holy water out of their churches last week and put in a bunch of new measures.
Yeah, so that's basically it for the like official requirements here in BC. The government is also advising and encouraging workplaces to be more lenient if people are sick, don't require sick notes, permit people to work from home wherever possible, and if they choose to. There's no official decision to cancel schools or close the universities. A lot of people I know are post-secondary education educators and teachers and professors who routinely teach classes of 3, 4, 500 students, and they're very nervous and are all getting ready to teach online classes soon, but that decision hasn't been made yet.
Yeah, this week where I was talking to a mutual friend of ours who's a professor at UBC, and he was expecting that pretty soon it was going to be UBC was going to end up being canceled for classes, and it hasn't officially come down yet, but it's looking more and more likely every day.
Yeah, Ontario, I believe yesterday, decided that they would extend their spring break by 2 weeks to 3. BC's public school spring break starts on Monday, and so they have 2 weeks off. And this is what Dr. Henry said today: is that's a good time to sit down, think about it, slow things down, not make any rash decisions, because there can be a value to having students in classrooms where you know they can be observed, you can teach them good habits and all of these kind of positive things. And also closing all the schools creates a lot more societal disruption, in her words. So ongoing reviews, but everyone's kind of on edge.
Yeah, a big part of the problem if you close schools, you have now a bunch of parents who have to, take time off work or send their kids to the grandparents or something, which then introduces another potential transmission vector for a vulnerable population. So overall, it can just spiral pretty quickly if you immediately cancel schools without having plans in place.
And then at the federal level,
So I suppose before we move on to federal level, we should also mention that the recommendations for workplaces has mirrored the similar recommendations for people to avoid going into work if possible when sick.
yeah, of
That
course.
which they've been pushing for basically since the crisis started.
Well, from Canada's perspective at the federal level, there's a lot of work been done by the Public Health Agency of Canada. Their website's very informative and useful. They were also the first to put measures in place at 10 international airports across the country, including here in Vancouver. These are ways they can help identify travelers who may be ill, collect contact information if they need to follow up with the people from specific regions. And they're also providing different travel health notices that you should take a look at. But I mean, probably not a good time to take a trip, no matter how cheap it looks online.
Yeah, I was planning on making a trip overseas and have canceled those plans for sure, even though it isn't on the list yet. So currently they list China, France, Germany, Hong Kong, Iran, Italy, Japan, Singapore, South Korea, and Spain, which are the major hotspots. But there's also, I mean, where I was looking to go to the Netherlands, they're up to 600 cases right now. And that's only going to get worse. And I think we'll be mentioning this a little later on, but someone high profile just came back from the UK with who tested positive. So it's made sense why BC in particular has expanded that list, but I expect the rest of Canada will follow soonish.
And of course, Canada's also funding research and clinical trials and working with the provinces to expand testing. Stuff you would hope they would be doing.
Yeah, BC's taken a fairly aggressive approach to testing, which, when you're looking at the news coming out of the States, is a relief for us, even if it is worrying for down there.
Yeah, and it's been picking up. Dr. Henry mentioned today that they've tested more people in the past week than had been tested in the week prior that, all the way to the start of the outbreak. So we're really ramping up here in BC, and I feel optimistic. We're hopeful. We're in a good position.
Yeah, I don't know. It's really hard to say. Like, it feels like the calm before the storm here, but Dr. Henry's is still fairly confident there isn't widespread community transmission, and hopefully it remains that way and that confidence is borne out.
Indeed. But while there is a lot of reason for optimism, there's still some specific cases, I think, that are very worth mentioning. Most notably, this afternoon, it was confirmed that Sophie Gregoire Trudeau, the wife of the prime minister, has tested positive. This morning, they announced that they were both going into social isolation after she was exhibiting symptoms. And now it looks like she's the most prominent Canadian to have coronavirus.
Yes. So this morning it was announced they're going into isolation while they waited for the test results to come in. And pretty much just before we started recording was confirmed. And now the prime minister, as a result, is going to be in isolation for the next 14 days. And I don't think he's the first world leader to be potentially exposed, but I think he'll be one of the more high profile ones, especially in the West, so to speak.
I mean, there's been a number of people who have met with Trump while they likely had COVID-19. Not to say he has it, but
He's actually refusing to be tested, so
which is all, par for the course.
insane, but yeah.
And he's in a very high risk category. Yeah. The other major political leader in Canada today to decide to go into self-isolation was Jagmeet Singh, although it sounds like his symptoms do not mirror what coronavirus is. He's just being abundantly cautious, which hopefully that clears up and he's able to get back out there.
Yeah, it's good that our leaders are, well, leading by example on this one.
And of course, there's a premier's meeting coming up in a couple days, I believe, or even in the next week.
That's now being officially postponed.
Things change fast.
Yes, well, as it officially got postponed after Trudeau's decision to isolate, but a bunch of premiers, I think, for particularly Manitoba and New Brunswick, had been calling for it to go to teleconferencing rather than an in-person meeting.
Which would make sense. But it's also difficult to do those kind of meetings over the phone. So there have been some initial steps to try to tackle this. The federal government earlier this week announced probably just the first aid package, I guess it's been called, of $1 billion to try to respond. That
Yeah.
billion. Go ahead.
Things have moved fast. It seemed like a reasonable-ish step Wednesday morning, and less than 48 hours later, seeming much less so, and that more needs to be done. But yeah, it was $1 billion, half of which was just going to go to the provinces to help them cover their costs. $275 million for research, including vaccines, $200 million for medical supplies, as well as waiving the 1-week waiting period for EI benefits for sick leave.
Yeah, this is one that I think a lot of people pegged right away as something the federal government could do, because under EI, just like you can go on parental leave or caregiver leave, there's a leave for if you have a serious illness. And that was generally something that had to be fairly serious because you needed to take at least 2 weeks off to make it worth it, because you only get 55% of your salary and you had to undergo a deferral period of a week where you got no benefits. A lot of EI programs are like this, and they consider it kind of like your deductible, which feels like just a way to punish people who lose their jobs or get sick. But I think it's their way of discouraging people from abusing the system.
Yeah, I think that really is it. Like they don't want the EI system to pay out for just every time someone takes a couple of days off work. So it was, I think, designed around covering the more serious cases. But when the situation like this drastically changes, and you want people who show even the slightest symptoms to decide to not go into work and not potentially expose anyone else, that approach doesn't necessarily work. You want them to put a lot more flexibility in it.
Yeah, and so opening this up and funding more Service Canada call center people to process these claims as they come in is helpful. it's still a cumbersome process to apply for these kind of benefits from EI. I had to go through it a couple times to first get parental leave and then a caregiver leave in the fall. But I mean, labor is effectively a provincial jurisdiction, and so it comes down in most sectors to the provinces starting to act, and that's where I think we'll get to in a bit about the calls for what else provinces could or should be doing. But people wanted this waiting period gone, and it's gone for now, and that's a good thing.
One thing that is noticeably absent from this response package is anything to cover the economic turmoil and calm the markets that are, well, in a state of freaking out. We've seen massive drops. I think the TSX index is down close to 25%. The S&P definitely has dropped that much over the past 2 weeks, and there's a lot of concern about the fact that this virus may end up causing a lot of economic pain, and what the government's response to that is going to be has not been seen yet, and it's starting to feel like that needs to happen very quickly if it's not going to spiral out of control.
But I've been trying to think about this question of like, what could they actually do? Because on the one hand, the advice is stay home, stop holding big events, effectively stop spending money other than maybe on your Netflix and Amazon Prime account or Amazon deliveries. But even then, someone still has to come to your door. If people aren't spending money, the economy's not turning, and people aren't working as hard.
Yeah,
what do they do?
This has more challenges than your typical recession in terms of having a stimulus program in place for exactly those reasons.
It's a fundamental paradox or contradiction of this element of capitalism almost.
Most of what I've seen some of economists put out various, well, mostly Twitter threads on this, including past guests Lindsay Tedds and Kevin Milligan. So check those out. But a lot of the responses are around basically providing income supports to people who are going to be affected by this directly because of the contractions in the tourism industry, the hospitality industry, and a lot of those related fields, as well as injecting some liquidity into the markets. And it's worth pointing out that despite what some of the federal opposition parties have been saying, we're actually in very good financial shape. And I think we can increase spending by something like $40 billion before the debt to GDP ratio even just starts to go the other way. And in a crisis, you can definitely push it into going the other way.
I think I saw, it might have been Lindsay Ted suggest on Twitter that money is basically grows on trees at this point because rates are so low. And I think my gut reaction to that is it's actually easier because trees take a long time to grow, and we don't need paper money anymore. So you don't need to wait for the trees. You can just make money appear.
Yeah, so as of like a day ago, the like 30-year Canadian government bonds had a yield of around 1%, which is less than inflation. So
it's more than the markets have been doing recently, though.
Yeah, in practical terms, it means the government could borrow $100 billion, only have to pay out $1 billion a year in interest payments, and inflation would actually make it so they're coming out positive on this one. So there's plenty of reason why the government should be looking at a very aggressive stimulus plan. And we have the short-term issues, which are going to be, I think, more complicated in terms of solving. But there's also then the longer-term stuff that they can start to commit to and start to roll out. And infrastructure is one of those things that tends to be a favorite of stimulus packages, but as a practical matter, there are rarely shovel-ready projects that are just waiting for some funding to show up. But it gives them the opportunity to basically signal that, yes, we're going to be spending a lot of money over the next several quarters in order to keep this going. And it's not just going to be a one-time thing. And there's some benefits to that.
Well, talking about the signals that are being sent, the Conservative leadership candidates have all been eager to weigh in on what they think should be done. I saw Mariek Walsh with a thread on Twitter rounding up some of the highlight reactions. First off was Peter MacKay, who emailed supporters trying to linked the issue with Trudeau, quote, throwing some more of your money at the problem, kind of directly countering everything we were just talking about in terms of what economists were recommending. And he also applauded Trump's travel ban as, quote, bold action that Canada should similarly adopt, I guess.
Yeah, and it's I've seen some people who definitely aren't conservative supporters that I just know who've been liking the idea of cutting down international travel in this case. So I don't want to directly equate it with just with the Trump situation, although that has plenty of problems there. But the general position a lot of public health experts has taken is that at this moment, containment isn't really all that likely to be effective. There's too much community transmission happening in too many places in the world. And it's much more now the case that you need a response to kind of slow the spread rather than stop it, and that travel bans probably aren't going to be effective and may even hurt the ability to deploy resources to different countries that are in serious need.
Especially when your travel bans are like Trump's, where you're targeting the Schengen zone, so most of Europe, but not the UK.
Well, the UK is not in Europe anymore.
Depends depends on the line you draw.
Well,
And
Brexit has Brexited, so
exactly. But then they also apparently, after he said all flights are canceled, well, actually, there's exemptions for Americans and American nationals in certain situations. Although now you have to try to find an empty plane to get on.
well, yeah, the Trump press conference last night was a absolute disaster. Or not press conference, his address, and I mean, he got multiple parts of his own policy wrong and caused a whole bunch of panicked reaction, including having all the Americans flood to the nearest airport to try and get emergency flights as they thought that Friday was going to be the last day they could fly home. Turns out not to be the case, but in countries with major COVID-19 outbreaks, such as France and Germany, having a bunch of panicked people in a small space, in a relatively small space in an airport was not a great idea. And this was a needless case of that caused by Trump's incompetence.
Well, someone else who was talking up halting all flights was fellow conservative leadership candidate Aaron O'Toole, who on a Facebook post started with, "Here are the facts," in all caps. He highlights
That's a great way to start.
Yeah, it's always reassuring. Today, Trudeau made it clear he has no plan to stop the spread of the virus that has shut down other Western countries. It's time to halt all flights from countries with a high rate of infection and mandate a 14-day self-isolation period for all travelers returning from high-risk areas.
I mean, we kind of started that last one here in BC as of today, but
he complains that the money is not enough. And then he also complains, of course, that Trudeau is giving $50 million in international aid for COVID-19 instead of making sure our people are taken care of at home first.
$50 million is such small. It's like couch cushion change to a $300 billion. Actually, I think it's 320 over $300 billion federal budget. And as we were mentioning, government money is practically free right now because of how low it can borrow, and just it's not a constraint on how much the government can spend on Canadians. The fact that it put $50 million to international aid.
Well, and if our $50 million in international aid can help slow or stop outbreaks in other countries, that does benefit us in the long run.
Yeah, for sure.
I don't feel like that should be a controversial or confusing point, but here we are.
Nope.
And finally, Derek Sloan tweeted out in February, Health Minister Patty Hajdu said hashtag coronavirus was, quote, low risk to Canadians. Now she says 30 to 70% of us could become infected. Can we trust whatever she'll say next?
Ugh.
Which, to break down the context, it is still low risk for Canadians right now. There are projections that if it does fully outbreak in Canada, 30 to 70% of people could become infected in the future.
Yeah, that 30 to 70% is one you see quite a bit. Like there's similar projections in the US in terms of global population too. It's a fairly common one that we're expecting a lot of people to have. And the trick now is to ensure that that happens over a long period of time rather than all at once, because you know, hospitals just don't have a lot of spare unused beds sitting around just waiting for a case like this. So if it does become a major issue where everyone's in hospital all at once, it overwhelms the healthcare system and the system breaks down. And then in addition to the illnesses directly related to the virus, you also have cases where, someone gets in a car crash, they might not be able to get the help they need because the healthcare system is so overwhelmed dealing with the virus.
And this is what people mean when they say flatten the curve.
So before we leave the federal politicians, it's also worth mentioning that the federal NDP have been pushing pretty hard on a bunch of stuff too. I've really appreciated here in BC how the fact that all the parties have just kind of come together on this one and aren't using it to take pot shots at each other or politicize this at all. And I mean, I wonder how much of that might have to do with the fact that the opposition's led by a doctor.
I think it also helps that this has been a break week in the legislature. And so I think the last day or two before the break, question period might have started to get onto this. But this week, it's been no forced kind of combative approach. And we also get next week off of legislature as well.
Yeah,
at the same time,
had, Mike Bernier, the Liberal health critic, congratulate Adrian Ditz, the health minister, on an effective job here. So it's more than just the fact that they aren't butting heads, but there's respect across the aisles for how everyone's handling it.
Absolutely. I didn't want to suggest that it was a toxic situation, but just there are multiple ways that things are working out well in BC, and
it's a little less so in Ottawa. In addition to the Conservatives we've been talking about, yesterday the NDP was attacking the Liberals for the fact that most workers wouldn't be covered by Liberal responses, but I mean, most people in Canada don't have their workplaces and their labor laws regulated at the federal level. So it was kind of a bit of a case of attacking Trudeau for something that he couldn't actually do, and felt like a bit of cheap politicization of the situation, which I kind of wish they were taking more of the tact that the politicians here in BC are.
Yeah. I mean, I am hoping that here in BC, we will see politicians try to push the policy envelope on how we can support people. One of the big calls recently has been to expand the labor code requirements that would put out that employers have to provide paid sick days and not just unpaid sick days or unpaid leave. BC recently passed brought in just before the break, the bill to extend paid leave for survivors of domestic abuse, and people largely across the aisle applauded that.
Yeah, I think it's going to be a little harder here to start to put that out as new mandates, particularly at this time, because it is really going to hit a lot of those small businesses, particularly in the hospitality industry, pretty hard. And it's one thing for a major company to start implementing these sick leaves, but a lot of like the smaller, mom and pop businesses with a couple employees don't necessarily have the financial wherewithal to cover 2 weeks of salary or wages at a time where their own revenues are drying up because nobody's traveling. So it might be a case where there needs to be a government backstop to help that out, rather than just relying entirely on mandates to companies that might not be feasible.
100%. And like we were talking about earlier, this is one of those situations where the government has a good, clear requirement and obligation essentially to step up and fund us getting through this and helping people take time off if they need it. Because one of the things that always comes up is it's very easy in many roles. I'm sure your job provides paid time off for sickness. I could get it if it's not in my contract right now, but people in better situations have that flexibility. But those who are in precarious work, are in small business or working for small businesses, don't often have that. And it's easy to ask everyone to do their part, but not everyone has that same capability. And so taking those barriers out of the way by whatever means necessary, I think is what we're going to need to do. Well, let's move into the leadership roundups, which the main story in both the BC Green race and the federal Conservative race, I couldn't find anything about the federal Green race, is that all the events are being cancelled amid the ongoing COVID-19 responses. The BC Greens put out a notice this morning. The Conservatives have sort of one by one said they're postponing their leadership race. I think Rick Peterson might have been one of the first to say he's not going to host his rallies or events. I'm not sure how many people were going to his events, but he's being safe. He's being cautious.
Yeah, I think him and Peter MacKay both released announcements around the same time. But yeah, that the day all the leadership campaigns more or less decided to postpone a bunch of events. You've seen something similar down in the States where both the Sanders and Biden campaigns have been reducing their in-public events quite a bit.
I'm sure by the debate, they're just going to Skype each other from their bedrooms.
Well, they canceled the audience for the debate. So it's just going to be the two of them and the moderators, I think.
That's probably a fair, safe choice. They've already told people not to applaud at those debates for a while anyway, so it doesn't even make sense to have audiences there.
Yeah, it's probably actually going to improve the quality of the debate a bit.
All right. But beyond canceling events, I think the only other thing that came up just before the latest raft of news took over everything is Peter MacKay announced a policy.
Yeah, so Monday morning, Peter MacKay sent out a policy announcement that he wanted to make it easier for people to buy homes, specifically by taking money out of their RRSP. Right now, there's a program in place where for first-time home buyers, they can withdraw up to, I think, $35,000, and that towards a down payment, it has to be paid back over 5 years. Well, he wants to strap the cap and well as the requirement to repay it. And this is pitched as a way to say or make it easier to buy a home, as if the major problem with home purchasing right now is that everybody just has so much money in there saved up, but just in the wrong place, and it's hard to access.
It's the quintessential Canadian policy, though, where Liberals, Conservatives, and I think even the NDP have at all different times promised to do whatever they can to make it easier to buy homes. Never mind with this specific policy, most of the people who are struggling to buy homes probably don't have much money in their RRSPs anyway.
Yeah, I mean, there are some, and I could definitely see a case where I might be able to benefit from having a higher cap, although at the same time, that is rating one's retirement savings and it's not necessarily even the best financial decision to take what might be a diversified portfolio in RSP and put it all into one large liquid asset. So, but that's for individuals to make up their minds about. But yeah, for a lot of people, it's the problem is that it's just too damn expensive to buy a home because the home prices are so high, and you're not going to save your way to that, whether or not it means taking advantage of the RSP or avoiding lattes, as one local councillor offered a week ago, which you only have to start crunching the numbers to realize how absolutely ridiculous, orders of magnitude ridiculous that advice is. But yeah, at the end of the day, unless they're willing to put out a policy to actually make the cost of housing cheaper rather than trying to boost buying power, no politician's really going to be able to crack this one.
Yeah, and that's not really a policy that's easily in the federal government's wheelhouse unless someone wants to relaunch the federal home building programs of yesteryear. But that's not a traditionally conservative approach. So
the one thing I also want to mention is the rather unfortunate timing to put out a raid your retirement savings policy the day the market, I think, crashed 7 percentage points or something, somewhere in the range of 5 to 7%. So, not a great look to be doing it in the middle of a stock market crash.
No, that's just more bad luck for him than anything, though.
Well, that's being the Peter MacKay campaign to a T.
Yeah.
Bad timing, bad policies, and bad communications.
Well, aside from COVID-19, the only other thing I see on the agenda coming up is the federal budget coming up on March 30th.
Yeah, so earlier this week, it kind of got a bit lost in everything, but Finance Minister Morneau released the date of when that's going to be. But as we were kind of talking about a bit earlier, I would not surprise me if something big gets announced sooner. And yeah, this budget's going to be an interesting one because the situation's changed so much in the economy, and we'll have to keep an eye out for that. But I really hope he isn't waiting till then to release a bunch of stimulus policy, because it really starting to look like we need to have that to rolling out within the next couple of days rather than a couple of weeks from now if it's going to help stem the pretty big losses in the economy that's happening right now.
Well, I think that's all I have for today. I think next week we might drop the Fan Expo recording we did a couple weeks back with the folks from the Pop This podcast. That was a nice detour conversation into the politics of Star Wars, Star Trek,
Parks
Parks
and Rec, and Desperate Housewives.
Real Housewives. So that'll be a nice diversion. I think it'll be a break from the dreary news, and you can all look forward to that.
And that has been Politicos. Find links to everything we talked about at politicos.ca. Support the show and get access to its exclusive Slack channel at patreon.com/politicos. Our intro music credit is Beautiful British Columbia by Susan Plotnikov. Politicos is a production of Leg and Boot Media, and editing services are provided by Cortado Productions. Thanks for listening.